Today we will be talking about the Acapella, which is a vibratory positive expiratory pressure therapy device that aids in mobilization of secretions. It also prevents reverse atelectasis and optimizes the delivery of the bronchodilator in patients with COPD, asthma, cystic fibrosis, chronic bronchitis, pneumonia, or other diseases with secretion problems. The Acapella works by creating vibrations that travel to the lungs, which loosen and dislodge secretions. Significant positive expiratory pressure helps air to get around and behind trapped mucus. With a pressurized breath and a vibratory effect, the Acapella enables additional air to enter into the airways and move mucus to the larger airways where it can be coughed out. It uses a counterweight plug and a magnet that directs exhaled air through a pivoting cone to generate airflow vibrations between 0 and 30 Hz. Both vibration frequencies and the resistance pressure are adjustable to better meet the patient's need. It is available in two different colors, green and blue. The green one is for patients who are able to maintain an expiratory flow of 15 liters per minute or greater. The blue one is for patients who cannot produce a flow of 15 liters per minute. When using the Acapella, instruct the patient to breathe in more slowly and take deeper breaths than normal. Put the mouthpiece lightly in the patient's mouth to ensure that there is a tight seal. Instruct the patient to keep cheeks firm for better effect. Breathe out of the device faster and longer than normal. Repeat this 15 times, coughing after each cycle. Repeat the entire process 6 times for a maximum of 30 minutes. After each use, open the Acapella and allow it to dry on a clean paper towel. Follow with a sterile rinse. If the patient has cystic fibrosis, further sterilization is needed. Some advantages to the Acapella are improved secretion clearance. It's tolerated better than chest physiotherapy. It facilitates airway opening and prevention of premature airway closure, called dynamic compression. It is self-administered and effective in any patient position. It has both high and low flow designs for more custom patient care. It is adjustable in the frequency and the flow resistance on each design based on the patient's need, and allows inspiration without removing the device from the patient's mouth. You can also attach it to a nebulizer to the end of the Acapella to give an aerosol treatment. The shape of the Acapella is a disadvantage simply because it can easily roll off the table and become unsterile. Contraindications of the occupations are patients that have hemodynamic instability, intracranial pressure greater than 20 mmHg, nausea, untreated pneumothorax, and recent facial or oral and intracranial surgery.